Well, that's a really interesting question about case-based learning, because what happened is I was teaching third-year medical students in OBGYN, and I had two medical students who, at the end of the rotation, they came to me and they said, "Dr. Toy, we don't really feel like we're learning what you want us to learn." And I didn't really understand what they meant by that. So when I talked with them further, they said they knew that I was trying to teach them at a certain level and they just didn't know how to get there. So then over the last, about a year after that, then I just started trying to figure out different ways to teach. And actually these two students helped me, and I tried so many different curriculums and different ways of teaching, problem-based learning, team-based learning, and I finally said there's nothing out there that I can use. So I developed my own cases, and I used that for my students, and they loved it. And it taught them not only how to do well on tests, which they really liked, but also it taught them how to think clinically. And that's the hard part, is getting them to think about the mechanisms. How do you really think about disease? So that's how I got started, is that these students presented to me the problem, which is how to get them to a certain level, and then clinical cases was the perfect solution to that. So really interestingly, when I use the cases, the clinical cases that I developed, I was doing it mainly so that way the students could learn how to approach diseases and how to think about mechanisms, et cetera. But the result of that is that the students actually did much better on their standardized exams, national board exams, and my students, which were 6 or 8 students of the whole cohort, scored like 1 standard deviation above the rest of the students and versus the rest of the country. So actually we published that, and then that was accepted in publication and won first prize at one of the national education meetings. So that's one way that we knew that the outcomes were very good. The second way is because different faculty and the students themselves would say, Dr. Toy, we learn about the case that you taught us this morning, and we applied it later on during the day. And you know what? We could follow exactly what the different residents and the faculty were doing, and we understood what was happening. In fact, we anticipated it. So to me, case-based learning is so important because it teaches deeper learning and understanding and better care of patients, but also doing better on the multiple choice exams. So as far as the teaching cases go, these are really structured. There's 100 peer-reviewed cases. So in other words, these are not just by people who are experts in the field, but also they are educational experts. And on top of that, we have peer reviewers who are likewise experts to look over the material. So for the faculty, they can rely on the fact that these are clinical cases with basic sciences integrated. In fact, lots of the concepts that are just required for a person to be a very good physician. So things like patient safety, interprofessional, medical legal, ethics, other things other than the basic sciences. Now for the students, what's really great is that it's the clinical relevance of the concept, so they see and they can connect to the patient scenario. And that's very powerful for them because they can see the applicability and the practicality of what they're learning. So really that's the best way to learn, because it's really learning in the clinical context themselves. So in terms of how the teaching cases correlates to the USMLE Step 1 examination, first of all, the main goal of the teaching cases, as with case files in particular, is to try to train the learners to be the very best clinicians, physicians possible. That is the end goal, and that's what we're striving for. However, that being said, we take concepts from the USMLE Step 1 outline and make sure that we cover almost every one of those. I think that we probably cover about 97% last time I looked at that. And that's really looking at what is the core knowledge that a student needs to be the very best nurse practitioner, physician, PA possible. So we incorporate that, but we do it in a meaningful way. So rather than just memorizing and learning facts that may not be connected, we put it together in the clinical context. So nobody knows in particular what the ramifications are going to be for changing the USMLE from a score to just pass-fail. Nobody really knows, although there's some guesses. For instance, from the basic science viewpoint and the basic scientist friends that I have, they're very worried that the students are not going to really study much of the basic sciences anymore, because going to a pass-fail, they're really not targeting as high a score. And so the problem is these basic science concepts are critical to a person being the very best clinician possible. You just have to understand the basis of what we're doing. So the teaching cases are ideal because they incorporate the basic sciences and in particular the applicability and how to be the very best clinician possible. So what I would say to those schools that are going to be struggling with getting your students to pay attention to the basic sciences is use clinical cases. And the teaching cases are a great tool because they already incorporate the basic sciences, but in a way that the students would really be able to digest and to be able to see its relevance. Now, the other part of it is that likely the Step 2 CK, clinical knowledge examination, is going to have a greater weight. And there's some talk that there's going to be more basic sciences in that examination. So once again, the teaching cases are ideal because in our clinical versions, so every case has a clinical version, then we have basic sciences incorporated, so that makes it really easy for our clinicians to adopt and use those concepts, because most doctors like myself, we've been away from the basic sciences for 10, 20 years, and it's hard to really know and remember what those concepts are. So this is a really easy way to do that.